Well, hello again, everybody. A pleasant good morning to you. Welcome into another installment of the Keep Boone Healthy Community Information Channel, coming at you live this time. Trying something out here on this December 8th. We appreciate you joining us. And again, as always, these conversations are archived on the Keep Boone Healthy page, as well as the Boone Area Chamber of Commerce Facebook and YouTube channels as well. So you can continue to get quality information about our community in a variety of different formats. And we come to you with a little different conversation. Normally, this has been like all COVID all the time, right? But it is time to start branching out and getting into some of the other conversations that help keep Boone healthy. Certainly, everybody, whether you are employed by an employer that offers healthcare benefits, or you're one of those 1099 contractors like we have so many of in our area that are constantly seeking health insurance benefits and new plans and a way to value that as best as you possibly can, it is safe to say that health insurance and health benefits are on our minds constantly. As we think about the way that we are recruiting and retaining employees now, this is a big conversation for employers of all sizes to either offer healthcare plans. If you do, what types are they? If you don't, how can your employees get access to quality healthcare coverage? So we wanted to take that a step further with some changes to the Affordable Care Act deadlines that have been in the news here lately. Of course, that deadline has been extended to January 15th for effective coverage on February 1st. You still have the December 15th deadline to get effective coverage by January 1st. And we're going to get into that a little bit more later. But we know that this is topical. We have fielded a lot of calls from you, our members, about what plans are out there, what makes sense, and how to even make sense of what seems to be a constantly evolving topic in the ACA in general. So we have a brand new member here at the Boone Area Chamber that is well positioned to help us answer some of these questions and just talk more generally about what the ACA is, how it's evolved, and what it means for us here in the high country in terms of helping us solve some of those healthcare challenges. So we're pleased to be joined today by Adrienne Moore. She's the Director of Sales for North Carolina for Friday Health Plans. That's that new member that I was talking about. I'm sure you've heard a little bit about Friday here throughout the community in the last several weeks as they have gotten established here. But she is a registered employee benefit counselor, somebody that is worth their weight in gold right now, right? As we start to think about all of the different ways that we are retaining employees and caring for our employees, whether it's tangible benefits like healthcare or thinking about employee wellness programs or everything in between as we try to keep as many talented people with us as possible. So Adrienne, thank you very much for joining us for this conversation. I know that we could go a variety of different directions, but I am just so thankful for you to be able to come and help us make sense out of what is a very popular topic amongst employer circles these days, and that's how to make sure your employees have healthcare coverage.
Absolutely. Well, thanks so much for the fantastic introduction. What we'll be talking about today is just the overall individual health insurance basics specific to North Carolina. I myself, as David mentioned, am the Director of Sales for Friday Health Plans here in North Carolina. I'm based in Charlotte. A little bit about Friday Health Plans. We're a carrier based out of Colorado that is new to the North Carolina market this year, offering individual major medical or ACA plans, as well as small group ACA plans in the 2 to 50 range as well. But what we wanted to really go over today is just the general mechanics and basics of the Affordable Care Act and individual health insurance marketplaces. And that's what I'll be going over today. And we will have a Q&A session at the end of today's presentation.
And I'll just remind people before you get started, Adrienne, if you do have any direct questions, you can type those in the chat on either Facebook or YouTube, and we will get to those with Adrienne as she concludes her presentation. So if something strikes you during that, don't wait. Just go ahead and type it in there. We'll make sure those questions get asked. So without any further ado, Adrienne, take it away.
Great. Thanks again. So the Affordable Care Act was passed into law over 11 years ago, back in 2010. Other names that consumers like yourselves or employee benefit agents or brokers may be familiar with is the ACA. The formal name of the act is Patient Protection and Affordable Care Act, the PPACA, or a lot of times it's referred to as just simply Obamacare. Obviously, this passage of this act was politically and has been continually controversial to a certain degree, but certified application counselors and navigators, a lot of times those folks are with nonprofits, the local legal aid offices, Social Security offices, stay neutral. And so do independent agents that represent health products as well. What certified application counselors, navigators, and agents want for consumers as well as clients is the best policy for that client's budget. Also, what the Affordable Care Act did is it really changed the way health insurance works in the US, and I'll talk about a little bit about that in just a moment. What were things like before? Sometimes rates were less expensive and there were more PPO offerings available in the individual market, but medical underwriting and no subsidies were required. And again, I'll talk about that here in just a moment, a little bit further in detail in regards to what that meant. But basic insurance terminology, I always like to go over these simple explanation. So a deductible, that a lot of times that's the amount the consumer is going to pay before the plan pays. So if a member happens to have a policy of a $1,000 deductible and then an 80/20 coinsurance and then an additional out-of-pocket, again, what the consumer will have to pay before there's any cost sharing between themselves or the insurance company is, again, that deductible. So this amount they pay before the plan pays. Then we have a copay, a fixed dollar amount paid for a service. A lot of times a copay can be applicable on a plan before a member or a consumer gets into their deductible, or sometimes with certain plans, a deductible has to be satisfied first and then a copay begins. So again, depending upon the plan designs that you might be talking with a broker with or taking a look at on healthcare.gov, you're going to want to make sure you understand, when that copay comes into play. You then have the coinsurance piece. So the coinsurance piece is the cost split between the insurance company and the patient or the member or consumer. This is usually expressed as a percentage with the insurance company paying the higher percentage. So as I mentioned earlier, if you have a $1,000 deductible, then an 80/20, what happens in that is that's the 80/20 percentage is the coinsurance. That means the insurance company will pay 80% of any medical costs after the deductible has been satisfied, with the consumer or member paying 20% of any additional cost as well. The one thing that was great about the ACA too is a lot of times prior to the ACA, there was some plans did not have a max out of pocket, meaning the insured, if there was something catastrophic were to happen, was paying there was no maximum the insured would ever reach. And they were continuing to pay a lot of money out of pocket for, a lot of times a catastrophic or shock type of claim. But now with the ACA, the out-of-pocket maximum is capped many times depending upon the plan design. So that's the most money a member or a patient is responsible to pay for in-network and covered expenses during a given plan year. So let's say, again, for a simple plan design is $1,000 deductible, 80/20 coinsurance with an out-of-pocket maximum of $6,000. So if something catastrophic were to happen, the most out-of-pocket that client or that member would pay is that $6,000. Talking a little bit about the open enrollment and effective dates currently, as David mentioned at the top of the presentation, is so open enrollment is the annual window when consumers can change plans or newly enroll in a health insurance plan for the upcoming year. So currently, in FFM states, North Carolina is a federally facilitated marketplace. This runs from November 1st to December 15th. And that was actually expanded to January 15th earlier this year. So again, members and North Carolina residents have 75 days to enroll in coverage. Plans enrolled by December 15th take effect by January 1st of the upcoming year, and plans enrolled between December 16th and January 15th take effect February 1st. So right now, this is a great time to enroll. There's about another week left if consumers are needing a January 1st effective date to get that date locked in. So as I mentioned earlier, prior to the ACA, individuals could be declined on individual plans based upon their health status. Now, with the passage of the ACA, an application cannot be turned down due to an applicant's pre-existing condition, nor can benefits be denied due to a pre-existing condition. Also, a person cannot be charged a higher premium due to a pre-existing condition. Health questions are no longer asked on applications for major medical coverage. The exception to this, though, is tobacco use. If someone is a tobacco user, that does include vaping. That's a question that comes up quite a bit. That can raise the rates for that person up to 50%. So please take that into consideration. That's one thing too that you can talk with your broker or agent about in regards to that, any type of rate up. So again, and it's specific to North Carolina. So prior to the ACA, here in North Carolina, individuals actually had to be declined by a health carrier, which then made them eligible for the state's high-risk health pool. And again, since the passage of the ACA, that went away. And unfortunately, back then, while their pre-existing health conditions would be covered under the high-risk pool, the monthly premium was many times just unaffordable because there were no subsidies to help offset the cost of that premium. So under the ACA, and again, the only major medical plans out there are governed under the ACA or the Affordable Care Act. That includes individual and small group plans as well as large group plans. A lot of times large group, they're going to be more on a self-funded status. That's a completely different conversation. But for the most part, consumers looking for major medical coverage, you're going to want to look for the QHP acronym or qualified health plans. So the following plans, though, do not qualify, do not fall under the guidance of the ACA. That means short-term medical plans. Short-term medical plans have been really popular over the last couple of years, but again, those are not going to cover any type of pre-existing conditions. They will cover claims that are on a catastrophic type basis. But again, if you're really looking for major medical permanent coverage, an ACA qualified plan is the way to go. Also, there are other plans out there such as limited indemnity medical plans. This can also be referred to as a hospital indemnity plan that will help that would pay a flat dollar amount towards a hospital claim. But again, it's not going to cover and be as comprehensive as a plan governed under the ACA. You also have the ancillary supplemental plans such as accident, hospital, or critical illness plans. Those are great in regards to supplementing or lowering an overall exposure when it comes to a client's deductible or consumer's deductible or out of pocket. So if someone was to come down with, go into the hospital with a broken leg, that accident plan will pay a cash dollar amount, which the insured can use towards their deductible, or they can use towards just getting better and help utilize and put towards their, car payment, out-of-pocket expenses, physical therapy, things of that nature. The other plan is the health share or ministry health plans. Again, they will cover some benefits, but not all the essential health benefits, which I'll talk about here in just a moment. So you have the qualified metal tiers. So there are about 5 different levels of coverage offered through the ACA. Here in North Carolina, on an individual basis, there are 4 offered: catastrophic, bronze, silver, gold, and silver and gold. There is it's my understanding that no carriers, insurance carriers here in North Carolina offer an individual platinum plan. The catastrophic plans are available for individuals that are under the age of 30 with a hardship or with a hardship exemption from the marketplace. You then have the bronze plans. The bronze plans are for consumers who may be on a tight budget. Bronze plans a lot of times is a great option for them. A lot of times those plans will zero out with the expansion of the subsidies this year. And then you have the silver plans. Those are a great solution for consumers looking for coverage that's stronger than the bronze plans. They may be needing coverage for themselves as well as their dependent spouse, dependent children. They're most likely, more likely to see a doctor a couple different times throughout the year versus someone that may be on a bronze plan. And they're willing to pay a little bit more in premium just to have, a lower deductible and know what they'll be paying out of pocket in order to utilize their plan. Then moving into the gold and platinum plans, you have consumers, these are for consumers that may have a higher than average healthcare utilization. These are folks that, may have a chronic health condition and they need to see a specialist on a regular basis. They're going to pay a little bit more in premium for these plans, but again, keeping their deductible low, as well as having maybe those first dollar copays as well. Also, one thing I'll say is in regards to the silver plans, with the expansion of the American Rescue Act that was passed earlier this year, many of the silver plans, those plan designs, the overall cost associated with them have been brought down as well, which I'll talk about here in just a moment. So all of the plans under the ACA include 10 benefit categories. So though all ACA plans are required to have minimum essential health coverage, and this 10 essential health benefits include outpatient care, emergency room coverage, inpatient care, maternity and prenatal care, mental health and substance use disorder, obviously coverage for prescriptions, therapy including physical, occupational, and speech therapy, lab tests, preventive services, pediatric dental, and vision. Talking a little bit about the network types too, and this can vary somewhat depending upon the specific carrier as well. Here in North Carolina, some carriers offer something called a preferred provider organization. This tends to have more in-network options as well as some out-of-network coverage. You then have something called an HMO. This is out-of-network coverage only in the time of urgent care or emergencies. Sometimes with an HMO, referrals are required to see specialists. That's within a traditional HMO model. And a primary care physician must be designated and services as a gatekeeper of care. I know a lot of times some carriers are trying to move away from that. So referrals are not required from a primary care specialist. There are carriers out there that offer something called an open access HMO, which works a lot like an EPO, this exclusive provider organization. So when you're speaking with an agent or a navigator or someone that's assisting you in purchasing a plan, be sure to inquire as to what type of network the carrier offers. So then the EPOs, out-of-network coverage, again, only in emergencies. No referrals are required for specialists, although sometimes prior authorization is required. No need to designate a primary care physician. And again, this is very similar to an open access HMO. So let's talk a little bit about how to enroll in a plan. And let me talk just briefly about how rates are determined. So through healthcare.gov or a enhanced direct enrollment platform, rates are determined as to where the client lives. It's based upon their zip code and respective county, age, higher rates if clients are older and and all the same under the age of 16. How many people in a family are enrolling, and what plan do they want? What carrier, what metal tier, what plan design, and then tobacco use. Are they a tobacco user? Health status and gender do not impact rates as they did prior to the ACA, and rates are released by each carrier annually prior to open enrollment after being approved by the state's Department of Insurance, and are valid for the full upcoming calendar year. So if someone, let's say right now, someone is covered under an employer-sponsored plan, and then they lose their coverage, let's say in March of next year, they will qualify for something called an SEP, or a special enrollment period. And those rates will be the same as they are now during open enrollment. So there's no change in those rates. Those rates are good for 12 months. So getting into a little bit of the tax subsidies. So the tax subsidies and cost sharing plans that are available on the silver level plans, only available through on-exchange enrollments. And that's based on the income, that's modified adjusted gross income of consumers. So the subsidies, are also called advanced premium tax credits, certainly help lower the premium costs associated with ACA plans. Usually they should be reconciled on taxes, your CPA, a lot of times, or even if you're just, you have a very simple tax submission to do on an annual basis, any of the online, TurboTax, all of that, we'll take that into consideration, and is really nice. The other thing is the subsidies cannot be used on catastrophic plans. So again, the catastrophic plans are for individuals that are under age 30, or someone that may qualify through a financial hardship. So with the cost sharing reductions that are now available, this will lower the out-of-cost expenses, not only on the premium, but also will lower the deductible, the copay, and coinsurance for qualifying low-income applicants. And again, that's available on the silver plans only. So the American Rescue Act changes. So earlier this year, 1.9 trillion of the American Rescue Plan passed, and that intended to provide relief efforts to support those affected by the COVID-19 pandemic. So since April 1st and lasting through at least 2022, consumers are able to take advantage of the increased subsidies. So many consumers who already qualify for subsidies can receive even more help, and many consumers who didn't qualify for subsidies before, due to the subsidy cliff, can now qualify. And what happened with that subsidy cliff is that would be it was you either qualified for a subsidy, or if you made a little bit more than what you did the year before, you no longer qualified for a subsidy and were responsible for the entire premium. So that's really helped. Also, no one will pay back more than 8.5% of their household income towards the cost of the benchmark plan or a less expensive plan. And then also, in addition, people who received unemployment during 2021 will be treated as earning no more than 133% of the federal poverty level. So more information can be found, again, through that local broker or agent that you may want to work with. They'll be more than happy to assist you with this. And then talking to you about what's the difference between on-exchange and off-exchange plans. On-exchange plans, this is enrollment through the marketplace or healthcare.gov, or through an enhanced direct enrollment platform such as Health Sherpa or Stride Health. There's many out there. That's the only way to qualify for subsidies or cost sharing. Now, consumers that may not qualify for a subsidy or cost sharing agreement can enroll directly through the specific carrier. And again, no subsidy or cost sharing is available going through that route. But many times too, a broker or agent will be able to direct you and guide you through whether whether you're eligible for a subsidy or not, and the best way to enroll. So the basic way to enroll, again, is through healthcare.gov. The website is set up by the federal government or CMS to help consumers shop for health insurance. It's used by federally facilitated marketplace states, North Carolina being one of them. That means we do not have our own state-based exchange. And enrollment through healthcare.gov is on exchange only. And two, if you're looking online, a lot of times too, brokers and agents will use a quoting and enrollment tool called Enhanced Direct Enrollment Platform. This is an alternative enrollment platform used for on-exchange enrollments instead of directly on healthcare.gov. Consumers can still obtain subsidies and cost-sharing reductions they qualify for. So there's just a couple of those listed there. But again, I strongly recommend reaching out to a local or even just state-based, North Carolina-based health insurance agent who knows the market and can assist you. So again, just to reiterate in regards to the enrollment period. So the open enrollment period is going on now. It began November 1st. If consumers are really needing to get that January 1st effective date, they have about 8 additional days to enroll on or before December 15th for that January 1st effective date. Now, if they miss that enrollment, there's still time to enroll. You'll just have an effective date of February 1st if you enroll by January 15th. Also, there are several ways individuals can qualify for a special enrollment period after the open enrollment period ends. So loss of other qualifying coverage due to a job loss, COBRA expiration, divorce, etc. Permanent move from out of this a specific carrier service area from an old plan to a new state, marriage, birth, or adoption of a child or court order. So there's those are just some of the qualifying events. There's several others, and all of that can be found on healthcare.gov. Also, in regards to resources, in order to learn more, healthcare.gov is a great resource under the Get Answers section. Also, if you're looking for a qualified agent, certified agent as well, and that's a member of the National Association of Health Underwriters, you can just simply go to find an agent there. You can type in your area zip code, let them know what type of coverage you're looking for, and those agents will populate. Also, Kaiser Family Foundation, it's a nonprofit. They have a fantastic subsidy calculation tool as well if you just want to take a look at the potential subsidy you may qualify for this year. And then also there's the CMS Health Insurance Marketplace fact sheets and FAQs that's available there as well. So I know this was a lot of information to cover, but what questions can I answer?
Well, first of all, thank you very much for going over all of that, Adrian. I learned a ton just listening to some of the definitions of what we talk about, not only from the employer perspective when shopping for health plans, but then also from the user end perspective too, when thinking about what those plans will do for you. There are a couple of questions that came into us prior that I wondered if you could address. And you were just talking about one of them a moment ago when going through the qualified life event or that event that would allow you to maybe step inside to the marketplace and secure insurance because of losing insurance for one of those reasons. One of the common questions that we get here at the Chamber from people that have gone through that is, what kind of documentation do you need to prove one of those life events? Could you touch on that briefly if you've got any helpful information there?
Absolutely. So there will be certain documentation depending upon what that qualifying life change is that consumer will receive. So if they have, let's say, for instance, they have exhausted their COBRA, and they will get a notification from the COBRA carrier stating, your coverage has been exhausted. You now qualify for a special enrollment period under the ACA. A lot of times with these special enrollment periods, we always, again, recommend these consumers reaching out to a local agent or broker who can help navigate that, because that type of documentation will need to be uploaded along with their application to healthcare.gov. And coverage will not be put in place until that supporting documentation stating that they qualify for a special enrollment period has been uploaded successfully.
Another one of the questions that we get fairly frequently here from businesses, and understanding that a lot of our businesses here in this community are 15 or less employees. So that might not necessarily hit the right kind of numbers for some great efficiency in offering a health plan to employees that brokers will typically have a relationship with. So as employers are sending their employees potentially to the marketplace to find their own coverage, is there any benefit to the employer seeking some of that information out? Or does that, because so much of this is income based, is it really better for you to send those individual employees through that process on their own rather than trying to take a collective group approach to that, if that makes sense?
Yeah, it really depends on what what the business owner is looking to do. Is the business owner wanting, one of the biggest things and one of the advantages of offering small group health coverage is, that's a big benefit and a great way to retain employees, because a lot of times those employers in that's under 15 or less employees may not be able to contribute or set up a small group plan. So it's really dependent upon, again, sort of what's important to that small employer. Obviously, it's always ideal for a small business to be able to provide employee benefits, but sometimes that just may not be feasible. But again, I would recommend that small business owner, whether they are referring their employees out to the marketplace, or if they're interested in looking at, potential costs associated with a small business health sponsored plan, to again work through a local broker or employee benefits consultant who can assist them with that. It normally doesn't cost a consumer or a business owner any fees up front to consult with an independent broker or agent.
My last question for you here is asking you to kind of take the crystal ball out for a second. And you mentioned through the American Rescue Plan that there are enhanced subsidies, and certainly some families right here in the high country have already benefited from that. And many have taken the opportunity to step into the marketplace because of those enhanced subsidies, and maybe they qualify for one now. What happens when the ARP funds run out? Is there anything that suggests that we'll revert back to some of those initial benchmarks in terms of eligibility, or will the government kind of, in your estimation, blend all of this together to where we don't necessarily go backward, but maybe we have a new way of operating with the ACA moving forward?
Yeah, absolutely. I mean, there's I would hate for things to be rewound with the Affordable Care Act. I think that there'll be additional changes and additional subsidies or things blended together into 2022 in order to preserve the current subsidies that are available moving forward. So again, I see, we want people to be covered under major medical coverage. We don't, the biggest cost associated with bankruptcy is because of medical hardships. And so, I think it behooves the federal government to expand the subsidies. Also, one thing that would be great here in North Carolina is if Medicaid could be expanded as well, because we do have the issue of consumers that fall within sort of that gap or donut hole that actually don't qualify for subsidies because Medicaid has yet to be expanded.
Well, this has been fantastic information. I cannot thank you enough for sharing this. And I would not want to let you get out of here without telling us a little bit about Friday Health Plans. We mentioned that you're a new member here and have given this information to us, as we often ask our members to be experts in their fields. You have come well equipped to be an expert on all things related to the ACA. But we'll give you a second, Adrian, and tell us a little bit about Friday Health Plans now that you're new to the area, and how people can engage with you if they've got any more questions about this or anything else related to insurance.
Wonderful. So Friday Health Plans began back in 2015 by two health insurance technology veterans who wanted to create a friendlier and simple and easier to use health insurance plan. So in 2017, they actually purchased a company out of Colorado called Colorado Choice, who had been in business the last 45 years and primarily insured folks in the rural markets in Colorado. So since then, we were able to leverage the top-notch customer service that Colorado Choice brought, as well as expand the technology as we expanded to the new markets. So last year we expanded outside of Colorado into Nevada, New Mexico, and Texas. And our expansion markets for this year include Oklahoma, Georgia, and North Carolina. But we very much believe too in having a local presence in the markets we serve. I think I said at the top of the presentation, I'm in Charlotte, North Carolina, as well as my sales team. I'm supported by a sales and marketing coordinator, as well as a senior sales executive. We're in 41 counties across North Carolina this first year, and looking to expand into more urban markets in 2023, but really excited to be a part of the Watauga County and Boone Chamber of Commerce organization and presence. We actually sponsored the marshmallow fight at the Festive First Friday this last Friday. It was
I was about to say, you all were right there at the epicenter of all of the fun on Friday night in downtown Boone. So.
We sure were. So it was a great partnership. We're looking forward to a very fruitful partnership.
Well, Adrian, we certainly appreciate getting to know you and getting to know that through our conversation. And this is one of those benefits of membership, right? As we talk to Adrian and her team about getting Friday health plans a little bit more integrated into our community, we started talking about the different levels of expertise that they had as an organization. And we stumbled across the Affordable Care Act. And we said, there are a lot of questions that people have about that. We should put that on Keep Boone Healthy. So that the fruit of that conversation came forward today. And again, we'll remind you that as Adrian mentioned, a lot of information shared here this morning. You can go back and watch this on the Boone Area Chamber Facebook or YouTube channel, or the Keep Boone Healthy Facebook or YouTube channel, and go back and maybe scrub through some of that information that you were scribbling furiously through and may have missed a detail. We want to make sure that you get the best information that you can, not only for yourselves, but again, I can't reiterate this enough. Employers are looking for any way possible to retain employees through benefits, through just being nice, whatever the case may be. This could be one of those conversations that you can have with your employees to make sure that they are indeed covered should something pop up from a health perspective, and have quality coverage that can be afforded through some of what we talked about today. So, Adrian, thank you so much for joining us. We look forward to talking to you again, and appreciate you taking the interest in our community and jumping in with both feet as you all have, and I know we'll cross paths again soon.
Very good. Thanks very much, David.